Great. Well, welcome everyone. My name is Michelle Taylor. I am an advisor here with Luma and Fairport Wealth. And this is part of our Fairport and Luma Wealth and Wellness webinar series. Today is actually our second part of insurance. And today we're actually going to be talking more about Medicare. And I'd like to welcome Pat Taylor. He is from Ohio Health Benefits. And he's going to provide us just a lot of education about Medicare and the options that we have today. Just a little bit of background on Pat. He's actually been a resident of Northeast Ohio for the last 21 years. He's also been in the financial services and insurance industries for the last 25. And when you hear Pat talk about today, something that I think is unique and that you all should know is really, he deals with all of the major medical insurance carriers, so such as Medical Mutual, Anthem, AARP, United Healthcare, Humana, Aetna, SumaCare. So he's very familiar with all of those out in our marketplace today. Just a couple of housekeeping items that I want to make sure that we mention. You will see that we have a question box in your webcam corner. If you would like to ask any questions, we will be taking them throughout today's presentation and also at the end. So without further ado, Pat, I'm going to turn it over to you and you can kick us off today.
All right. Thank you, Michelle. Good morning, or I should say good afternoon, everybody. Again, my name is Patrick Taylor. I'm with Ohio Health Benefits. We are a health insurance provider in Northeast Ohio. Our main office down in Talmadge, Ohio, but I work up in the west side of Cleveland. So today, I'm sure when everybody got up today, they said, gee, I hope I have the opportunity to learn about Medicare today. It's exciting stuff. But unfortunately, as we all get older, these are things that we have to think about and deal with as we get older. So today, what we're going to talk about is Medicare 101, what to expect as you approach age 65. That's the first and the most important. Number two, do I have a sign up for Medicare? Do you need to sign up? When do you sign up? We'll go over that. Also, what is original Medicare? What's that all about? The next topic we'll talk about is what are other Medicare choices do I have? So what choices are out there for you? You may have heard of the infamous donut hole or coverage gap. We're going to go over that. And then we also have other factors to consider with Medicare. And then the last topic we'll discuss briefly is IRMA, I-R-M-M-A. Basically, that stands for Income Related Monthly Adjustment Amount. And that is based on your income as far as how much you may need to pay additional for your Medicare Part A and B. Okay, so that's what we're going to talk about today. And we'll go ahead and get started. And please, if you have questions, let us know. And there will be some poll questions along the way to keep everybody involved. So thank you. All right, so what to expect as you approach 65. First of all, be prepared to be overwhelmed with phone calls. Your phone's going to start ringing off the hook. Your mailbox will start filling up with mail. We've had clients that used to collect all the stuff they got in the mail and use it to start fires because it would stack up to 6 to 8 inches worth of stuff that you're going to get in the mail. So be prepared to get all that stuff. And that's another reason why it's kind of important to have somebody that you can reach out to and somebody to talk to help decipher all the mail and phone calls that you're going to get. Many of your friends and family are going to have opinions on Medicare. What works best for your friends and family may not work best for you. So everybody has different situations. I've sit in hundreds of calls where they say, well, my neighbor told me this and my neighbor told me that. And so we just have to, everybody's situation could be a little bit different. So that's something that we got to keep an eye on. If you are collecting Social Security currently, you will get a Medicare card in the mail about 90 to 120 days before your 65th birthday. That's if you're collecting Social Security. If you're not collecting Social Security, you actually have to go onto the Social Security website or call them to apply for your Medicare if you need to do so. However, if you're going to continue to work and have group coverage, you do not need to sign up for Medicare when you turn 65. Okay, and that's something we'll go into a little bit more further into the webinar. Next, coverage will start the first day of the month that you turn 65. So if your birthday is on June 23rd, your Medicare will actually start on June 1st. Okay, if your birthday happens to fall on the first of the month, you can actually start the month before. All right, and then the last thing to talk about again is the IRMA calculations. What IRMA does is they look back 2 years on your income. So they're going to look back, if you start at 65, they're going to look back to your tax return when you're about 63, and they're going to want to look to see what your income was. Michelle or Annika is going to send out to everybody the IRMA worksheet. Okay, so just to go over quickly, the first one is if you file individually 87,000 or less, then you're only going to pay your Part B of $144.60. However, if you make more than that, there's going to be additional premiums on top, and there's different levels of that. So I don't want to go into all of them, but we'll make sure that these worksheets get out to everybody so they can look at it and they can determine on their income level what they may have to pay for their Part B premium. Okay? So go on to the next screen. Do I have to sign up for Medicare? We touched on that a moment ago. If you're not collecting Social Security, then you'll not be automatically enrolled. Again, if you are collecting Social Security, they automatically enroll you, but you do have the ability to opt out if you're still working and on group care. So you will have to, if you're working and you decide to take Social Security, they enroll you. There's a form that you have to sign to say, no, I do not want to take my Medicare at this time, and I'm going to put it on hold until I go off group insurance and retire. You may not need to sign up for Medicare if you have employer coverage from your employer or spouse's employer. So we have a lot of clients who they may not have insurance, but their spouse has insurance. So either or, it doesn't matter. It can be on your insurance or your spouse's insurance, and you don't have to worry about signing up for Medicare past 65 as long as you are on your group coverage or your spouse's group coverage, okay? You should evaluate your options, Medicare versus employer, before making a decision. I have a good friend of mine who is still working. He just turned 65. I asked him to send me over his, how much does it's coming out of his paycheck every month for his group insurance. What happened was I reviewed that versus what it would cost to be on Medicare. I come to the conclusion it's cheaper for him to stay on his group insurance than to go on the Medicare. Even though Medicare's insurance is usually a little bit better, but it was much cheaper for him to stay on group insurance. So he decided he's going to stay on group insurance for another year till he retires, and then we'll get back together and go over it. If you keep your employer plan after turning 65, you will have the option to enroll in Medicare at a later date without a penalty. So there's going to be a form that I'm going to have Annika and Michelle send over. That form is called a CMSL 564. And basically what happens is about 60 days prior to you retiring, let's say you retire at 70, you'll want to take that form to your HR department, have them sign that form, the HR director sign that form that basically shows that you had credible insurance coverage from the time you turn 65 until you retire. That way there's no penalty, okay? So as long as you have that form signed and you had credible coverage, you don't have to worry about a penalty, okay? And then the last thing to worry about is deciding factors might include your spouse's situation. So what that means is maybe she's only 63 and you're 65 and you're going to retire and go on to Medicare. Well, that kind of leaves her hanging out there. So she won't have insurance any longer if she was on your group insurance. So now what she'll have to do is go out on the market to like Obamacare or to the Affordable Care Act and get insurance, which can be extremely expensive. I've got clients all the time that are paying $500, $600, $700, $800, $900 a month to be out on the market like that. So a lot of times people will say, you know what, I'm going to work a little bit longer and stay on my group insurance so that my wife, till she turns 65, that way we don't incur a $600 or $700 bill a month for her insurance. So, next slide. What are the parts of Medicare? So when you get your Medicare card, it's a red, white, and blue card. It's going to have your name on it. It's going to have a Medicare number, which is random numbers and letters. And then it's also going to have down the right-hand corner, it's going to say Part A, and it's going to say Part B. And next to those will each be a date. Usually Part A is the date of your birthday when you turn 65. So if it was this month, it would be 9/1/2020. And then Part B, if you are taking Part B at this time, it'll be 9/1/2020. So what is Part A and what is Part B? Part A is hospital, inpatient hospitalization, skilled nursing facility, home health care, hospice. Usually there is no premium. And what that means is, as long as you've worked 40 quarters in your career, which is 10 years, you are all paid into Part A of Medicare. You do not have to pay for that. However, if you did not work your 40 quarters, you could end up incurring additional fees for Part A each month. That doesn't happen very often, but it could. So Part A is the hospital. If you go into the hospital, they're going to bill Part A first. Part A is going to pay 80%. So you still have 20% hanging out there. Now, over to Part B. Part B is, think of Part B as your outpatient services, your doctors, providers, preventative benefits, durable medical equipment like walkers and things. That everybody does get charged that. You do have to pay for that, and it will be $144.60. Now, we talked earlier about IRMA, the income-related monthly adjustment. If you make over the amounts on that $144.60 could change. Okay, it could go up as high, depending on income, as high as $491 if you're making over $750,000 a year. So that just depends on income, on what that amount is. It also will add to your Part D, which is D for drugs. Your drug plan could be adjusted as well. Medicare, I always let everyone know, Medicare was really never intended to pay 100% of Medicare cost. So we have different options for you with that. So you have Part A, hospital, Part B, medical. They both pay 80%, okay? So you have 20% left to pay. Other parts of Medicare, well, you have Part C. Everything's by a number or letter, you know, A, B, C, D. So Part C is Medicare Advantage plans, and those are the ones you see on TV all the time. As you probably noticed, more and more commercials are popping up on TV, and the majority of them are for Medicare Advantage plans. You must have A and B to enroll into an Advantage plan. It covers hospital, medical, and prescriptions. You must live within the plan service area. So plans have different counties or zip codes that they cover. So you have to make sure you're in the right plan for the area you live, okay? Part D is for prescriptions. Think as D for drugs is for prescriptions. Coverage only for RX. So that's for your prescriptions. Each plan has a formulary list, which means this is the amount of drugs that they cover. Some cover more than others. So you have to be very careful and make sure you go into the right formulary or the right plan with the right formulary. Tiered co-payments for RX. What that means is there's typically 5 tiers of drugs. There's 1 through 5. Tier 1 is typically a preferred generic. Tier 2 is generic. Tier 3 is preferred brand. Tier 4 can be non-preferred brand, and Tier 5 can be specialty drugs. So the higher that number, the more expensive that drug. I always tell everybody, it's good to try to ask your doctor, hey, can you make sure if you're putting me on this new prescription that it's a Tier 1 or Tier 2 drug, because your copay is going to be much less. If you get up to a Tier 3, 4, or 5, you could be paying anywhere from $40 to $150 for that drug, where if you're on a tier 1 drug, you might be paying $0 to $7 or $8. So it does make a difference. And then lastly, must have coverage to escape penalties. And what that means is you have to have prescription drug coverage. If you do not, they will penalize you. Now, the penalty is not gigantic, but it builds up over time. So if you signed up for Medicare and you decided you don't want to take a Part D prescription drug plan, they're going to penalize you 1% for every month that you did not have credible coverage from the time you turned 65. And that 1% is 1% of the average drug plan in the United States, which is about $34 a month. So 1% of $34 a month for 1 month isn't a big deal. But I let everybody know you can be hit with a penalty if you do not sign up. So we'll go into a little bit more here on the different types of Medicare, but right now there's going to be a poll question.
Yeah, and as we get ready for the poll, before we do that, just to remind everyone, if you'd like to ask a question, look over in your box towards the end, and you can open that up and ask any questions. But we are going to take a poll, and the reason we're going to do this is just to get a good idea of who we kind of have out there if you are looking at group insurance or not. So the question is, do you or your spouse plan to work past the age, that should have been instead of page, past the age of 65, where you may have access to credible group insurance? So either check yes or no as all apply, and then Pat's going to be able to address some of that as we continue on through the webinar. And as we're waiting for that, Pat, thanks for bringing that up as far as making sure that if you still have coverage and you're getting ready to go on Medicare, that there is a form that you've got to fill out. I think that that's super important so that you don't have any penalties. Well, let's go ahead and take a look. What did it show? Oh, wow. Okay, so we have 88% saying that yes, you will have access to group insurance versus 13% no. So Pat, maybe a couple comments on that?
Yeah, so it sounds like that a lot of you are planning on either working past 65 or will be on a spouse's plan past 65, which in most cases is usually the better way to go, especially if there's going to be an IRMA penalty on you because of your income. So it just depends. That's what I had mentioned earlier in our conversation, was that everybody's situation is different. So you have to look at it individually with every person and their income, their spouse, when they plan to retire, when they plan to keep, if they plan to keep working. So those are all things that you have to take into account when, you're getting to that point to make a decision. So.
Yeah, and Pat, one question that we have is, what are Medicare ratings and how do those work?
So Medicare ratings, what those are, there's a star rating, okay? And the star rating is 1 through 5, and every plan is rated on that star rating based on so many different factors: customer service, the plan availability, there's a lot of different things that go into that. Your average star rating is probably 2.5 to 3. I don't know if I've seen a 5-star plan. They are around in certain areas, but I don't know if there's even a 5-star plan in Northeast Ohio. There's very few of them throughout the country. So, if you look at a plan that's a 3-star plan, that's what the majority of them are, 3.5-star plans usually. So that's what the star ratings does. It just rates the plan, the customer service, all kinds of different factors with that.
Great. And we also have another question. So it says, what if you work at a place where there are less than 20 employees? Can you continue your group coverage?
So Michelle, again, you said if you work in a place where there's lots of employees, is that what you said?
No, sorry, less than 20 employees. Can you continue your group insurance?
Well, what happens in that situation is they will make you go on to Medicare. So what happens is you can continue your plan, but you will have to go on to Medicare. When you go on to Medicare, Medicare will be the primary. So it will go through A and B first, A for the hospital, B for your doctors. They'll pay 80%. Then your group coverage will come in behind that and help fill in the gaps.
Okay. That's all the questions so far, so let's continue on.
Great, thank you. Great questions, everybody. These are very good questions, and these are the type of things that everybody asks. So now we're going to get into a little more of the meat. So once you get your Medicare card and you see all these commercials on TV all the time, and you know, I've been doing this for many, many years, and sometimes I watch these commercials and I walk away scratching my head saying, I'm not sure what they're talking about here. So I can only imagine, you know, turning 65, not having any training or knowledge of this stuff, and then trying to figure it all out. It's not easy. So we try to make this as simple as possible. When I first got into this business, I realized how difficult it was to learn everything. So I've tried my best to keep it as simple as possible so people understand it. So basically what we have here, you have two choices. You have two paths. You got one to the left, one to the right. Path one is original Medicare. That's when you get your card and it has A and B on it. A for hospital, B for doctors. They pay 80%. Then what happens, you can pick up what they call a Medicare supplement, okay, or supplemental insurance. And those plans can be F, G, N, you know, there's different letters for those plans. The most popular right now is G. Plan F is really not available to anybody that turned 65 this past January. So that plan is kind of gone unless you already have it. So you have your secondary insurance, Plan G, for instance. So what happens is your original Medicare pays 80%. Your secondary insurance or supplement, your Plan G, comes in and picks up that other 20%. And what happens then, you're 100% covered. You have 100% coverage there. So with that, then you need a standalone prescription drug plan, which is Part D, as in drugs. And right now there's between 25 to 28 plans out there on your prescription drug plan. So that's your first option: original Medicare, a supplement, and a prescription drug plan. Path two is the ones that typically are on TV. All right. Those are your Medicare Advantage plans. Those are the ones you have to have your Medicare Part A and Part B. They also include your prescription drug plans are included. Where on that first path, you have to get your prescription drug plan separate. So everything is separate. Where this path two, everything is rolled into one. So you have your A, your B, your prescriptions, and you also have some extras. They throw in dental, vision, hearing. OTC stands for over the counter, and different benefits like that. And people think, well, gee, that sounds great. You know, it sounds really good. And it is. Both paths are good. Just depending on your situation, really determines which way you should go. If you plan on traveling a lot, going out of the state, maybe you have a home in Florida or a home in Arizona and you want to go there 3 or 4 months out of the year, Path one's probably the better way to go, because with Path one, you don't have to go to any particular doctor. You can go anywhere in the country you want to the doctor or any hospital. Where with Part two or Path two, those are HMO and PPOs, and you have to stay within their networks. So we'll go into a little bit more detail on those in the next slides. All right, so Path one, that was the supplement that we just talked about. So with Path one, MEDIGAP plans pay for your Medicare. So basically what that's saying is your Medicare is your Part A and B, your MEDIGAP or your supplement comes in and picks up that other 20%. You can go to any doctor in the nation. They do have a premium, and those premiums are going to be a little bit higher, but you have little to no out-of-pocket expense at all for treatment, okay? Premiums do increase with age, so as you get older, they will go up. I will never tell anybody that they won't go up, because they do go up. Plans are standardized. what that means is it doesn't matter if you go with Anthem, Humana, SummaCare, it doesn't matter what company you go with. If you do a Plan G supplement, they pay exactly the same no matter where you go. Okay, so it doesn't matter. The only difference in a supplement is your premium price. And the other difference can be some of them offer silver sneakers, some of them do not. So people come to me all the time and say, well, then I should just go with the cheapest plan. And I say, well, that's true to a certain extent. But my biggest factor that I tell everyone you should look at is you want to look at the plan's 5-year, what their 5-year track record has been. Okay. What have they done over the last 5 years with their premiums? I know companies that have went up $35 to $45 per month each year. And there are other companies that go up $5 to $7 a month, and they both have the exact same coverage. So that's what you want to look at is the plan. If you're looking at a supplement, you want to look at the plan's history to see what they've done with their prices over the last 5 years. And then last thing is you want to purchase a separate prescription drug plan, okay? So with Path 1, you've got your original Medicare A and B paying 80%. You then buy a supplement or a MEDIGAP policy, and then you get your prescription drug plan to help pick up your drugs. So that's Path 1, and how it works. You can go to any doctor, any hospital in the United States. So these are much better for people who do plan on traveling. Next, we'll go over Path 2. So Path 2 is the ones we see on TV. These are the Medicare Advantage plans. They pay in place of original Medicare. So basically what happens is you're really not technically on Medicare anymore. You still have to have your Part A and Part B, but whatever company you go with, they are now in charge of your medical health care. So let's say you go with XYZ company. It's either an HMO or a PPO. An HMO is a health maintenance organization, and think of a small box with doctors and hospitals in there, and you have to stay within that box. You have to stay in their sandbox. If you go outside of that sandbox, they do not cover you, okay? If you need to go to a specialist or something, you usually have to get a referral when you have an HMO. Now, a PPO is a preferred provider organization, and those kind of expand the box a little bit and make it a little bit larger. So there are PPOs that for people that travel, you know, maybe go to Florida. If you have the right PPO, it might have doctors and stuff down in Florida that you can use without being penalized. These have a much lower monthly premium than a supplement, but they have co-payments. So what happens is you may have as low as a 0 premium, but every time you use the plan, you're going to be charged. You might be $10 for copay for your primary care doctor. It may be a $50 copay for your heart specialist. If you need blood work, it might be $25. If you need an x-ray, it might be as high as $500. Urgent care could be $90. But where they get you the most is if you go into the hospital. These plans all are different, and they can get you up to as high as $385 a day for the first 7 days. So you could, you know, technically write a check up to $1,500 to $2,000 if you went into the hospital with a Advantage plan. With a supplement, you have a one-time $198 deductible. That's it. I like to use my mom as an example. Last year, she's 93. Last year, she went into the hospital 3 different times and then went into skilled nursing 3 different times. She spent a total of probably 60 days in the hospital in skilled nursing. She has a Medicare supplement on Path 1 that we just spoke about. It didn't cost her 1 penny. She probably had $500,000 in medical bills, never cost her $1. Where if she would have had this Path 2, the Advantage plan, most likely she would have hit her maximum out of pocket, which would have been about $4,500 she would have had to write checks for. So that's the big difference between a supplement and an Advantage plan. The Path 2, they do have the drugs included, so there's no separate premium. And many plans offer additional benefits not covered by original Medicare. So they will have in some preventative dental, preventative vision, hearing aids, and over-the-counter items. That's what they push real hard on TV. You'll see them say, "Oh, well, we have dental, vision, hearing." What they don't tell you is it's typically a preventative. So you might get to go in and get a cleaning once to twice a year. You get one eye appointment a year on most plans where they'll do a checkup. Some of them do have some very nice hearing aid benefits, and some of them have an over-the-counter benefit, which is like a prescription drug card. Well, I shouldn't say prescription drug card, a card, kind of like a debit card that you could go to, say, Walmart, and you could use it to buy health-related items. Now, most of these plans, it's very minimal. Some of them are $15 to $20 a quarter. Some of them go as high as a couple $100 a quarter that you can use those for. I tell everybody you can't buy beer and cigarettes with them, but you can, but you can buy, you know, vitamins, bandages, anything health related typically. Okay. So that's path 2, your Medicare Advantage plan. Next, we have another poll question coming up here. I'll let Michelle go over that.
Yeah, thanks, Pat. And as we go through the poll, if you all have some additional questions, we'll take those now as well. So for the poll, do you think the cost of your copays for prescriptions go up or down when you fall into the coverage gap or the donut hole, which is what we're going to talk about next? So take a minute and answer that question if you think it's going to go up or down. And as we're waiting for those to come through, Pat, thanks for going through those two different parts. I think it's pretty important as you start to explain the differences and why it is unique to each person's situation, because if you are traveling and you may have some higher expenses possibly in the future, maybe one's the better option to go than the second option. So let's go ahead and see what our poll said. Up, wow, 100%. Everybody says up, Pat.
Well, everybody did a great job with that. Typically a lot of people think it goes down, but you are 100% right. When you fall into the donut hole or coverage gap, your prescription drugs go up. So there are 4 tiers to a prescription drug plan. The first one's a deductible phase, and once you get through the deductible, then you go into the initial coverage phase. In the initial coverage phase, you pay a copay for your drug. So if it's a tier 1 or tier 2 drug that we talked about earlier, your copay may only be, could be as low as $0 up to $7-8 for that prescription. Once you have hit, the way you go into donut hole is what they do is they take the total cost, the retail cost of your drug. So let's say Januvia, which is a diabetes drug. Januvia costs about $465 a month. It is a tier 3 drug. So what happens is you are not paying $465. Your copay on that might be $40 a month. But what they're using to come up with the donut hole is they're using the retail cost plus your copayment. So if it's $450, we'll say for easy math, and your copay's $40, they're using $490 is going toward the donut hole. Okay. Now, when do you fall into the donut hole? I think we go into that into the next screen if we want to go into the next screen, but the donut hole is once you hit $4,130. So this has changed over the last few years. A lot of people ask me, they keep saying the donut hole is going away. Well, the donut hole is not going away per se, but they're making the donut hole harder to fall into by raising that dollar amount. For instance, in 2020, to go into the donut hole was $4,020. They raised it for 2021 to $4,130. I know it's not a huge raise, but each time they raise that, it makes it a little bit longer before you may fall into that donut hole. So the way that works is, again, they take the retail cost of all your drugs plus the copay of all your drugs. Once you've hit $4,130, you fall into the donut hole or coverage gap. Once you fall into that, now you're going to be paying about 25% of the cost of your drugs. So if you had a $500 drug, you're going to be paying 25% of that. So it's going to cost you, instead of $40 a month, it could be as high as $125 a month you're paying for that drug. Now, there is a fourth stage to the drug plans, and the fourth stage is if you get to $6,550 in out-of-pocket and retail cost of drugs, you go into what they call catastrophic phase. Now the price of your drugs all go back down. Now you're going to be paying no more than 5% of the cost of your drugs. The majority of people do not fall into the donut hole. Only about 20% of Americans who are on drug plans fall into the donut hole. But if you're a diabetic and you're taking insulin pens, those are about $500 a month. As you can imagine, you're going to hit that $4,130 sometime throughout the year. So that's why when I had said earlier in the conversation that try to ask for prescription drugs at tier 1 or tier 2, because that keeps the cost of your drugs down, and the chance of you falling into the donut hole are a lot less likely if you have prescription drugs that are tier 1 and tier 2. Once you get up into tier 3 and 4 drugs, there's a good chance you could fall in. Okay? Other factors to consider when choosing a path. You want to look at your future medical or prescription concerns, foreign and domestic travel habits, fitness habits, and your spousal insurance situations. And we kind of talked a little bit about all these so far, but you've got to look at, you got anything medical coming up or any prescriptions that you know you're going to have coming up. Are you going to do a lot of travel? Domestic travel, again, is better to have, in most cases, a supplement versus the Advantage plan because you can go to any doctor or hospital. Foreign travel is not something that is covered greatly, but there is coverages for that. If you have a supplement, they usually have a $250 deductible if you're traveling out of the country, and then they will pay 80% with a lifetime maximum of $50,000, and that is only on emergency medical. So if you just weren't feeling well with a cold or had a little bit of the flu and you want to go, that probably would not be covered with a supplement. The Advantage plans are a little different on how they cover the out-of-pocket for travel out of the United States. Basically, what happens is you will typically have to pay in advance, pay your entire bill. You'll have to get an itemized bill. Then you'll have to submit that bill for reimbursement once you get back into the States. We had a client that just happened to. The good thing is they were on a cruise. They got about 75% of their bill paid, but it took 4 months to get their money. So it's, the better option. There's companies out there that sell travel insurance. It's usually pretty inexpensive, less than $100, depending on age and what you're looking for. That will give you more than enough coverage if you're traveling out of the countries. I would highly recommend you look at those. Geo Blue is one example that comes to mind that does a nice job with travel insurance outside of the country. And then as fitness habits, that's if you were going to, I talked a little bit about silver sneakers. Some plans have it, some do not. So what to do if retiring but not yet eligible for Medicare? So we talked a little bit about that. Let's say you're going to retire at 65, but your spouse is on your insurance and she's only 63. So her options would be if your company would allow COBRA, and COBRA can be very expensive. You're usually paying 100% of the cost of the insurance at that point. You have the Obamacare or Marketplace plans, which are very expensive as well. They're usually anywhere from $500 to $900 a month. Then you have short-term medical plans. Let's say you're going to turn 65 in 6 months, and you can get on a short-term plan. And then you have your spouse's group insurance as well. So you could look to go, they might have that option to go on to that as well. So those are the options you have if you're not eligible yet for Medicare. And we do at Ohio Health Benefits, we do handle all of those. So.
Yeah, I think we're going to get ready for another poll. But before we do that, continue to enter in some questions in the question box. Pat, I do have a couple of questions for you. One is,
yes.
Do you have to go through underwriting to go through a Medicare supplement?
Okay, great question. So you do not have to go through underwriting when you first turn 65. I call it your get out of jail free card. It doesn't matter what your health condition is. They have to approve you on your initial enrollment period, which is when you first turn 65, or let's say you're 70 and coming off a group plan, they have to take you, no medical questions are asked. Okay. Let's say that you take a supplement and 3 years down the road, the rate's been going up, and you come to me and you say, or your agent, and you say, the rates on this went up. Is there any other companies out there that, that might be better? And I do this all day long, every day. Now you do have to answer medical questions to change your supplement. Supplements can be changed year round, any time of the year that you want to go to. So you can change at any time on the supplement. Advantage plans do not have medical questions ever, so you don't have to worry about medical questions with an Advantage plan.
Great. And what are some things that you should think about that maybe Medicare does not cover?
Well, the main thing that Medicare does not cover, they're not going to cover any non-medical procedures that aren't medically necessary. For instance, let's say you wanted to get a facelift or some Botox, or you wanted to get something like that. They are not going to cover it. So it's got to be a medical necessity. But I've run across that so little. I mean, we have over 15,000 clients, and I've almost never seen that happen to where something wasn't covered, unless it was something, it was more of a cosmetic type of thing, or you were going to, I call it, let's say you went to a witch doctor. You want to make sure you're going to a credible doctors. But other than that, you shouldn't have too much problem.
Great. Well, let's take a minute for the poll. When does annual enrollment begin for Medicare? September 15th, October 15th, November 15th, or January 1st? So we'll give folks just a second to answer that question, and we'll see what everybody in the group thinks. And actually, if you want to start talking a little bit about open enrollment too, what does open enrollment exactly mean before we find out the results?
Okay.
Okay, let's take a look at the results. All right, so September 15th was 22, October 15th was 33, November 15th, 22, and January 1st was 22. Well, those folks that answered October 15th for 33 are correct.
Yep. Well, that's everybody. That was pretty divided. Everybody was pretty divided on that one. But yes, October 15th is what we call AEP, which is annual enrollment period. And that is coming up for us. Annual enrollment is kind of like for a CPA, it's kind of like tax season. We work usually 6 days a week and many, many long hours because we have a short time to get a lot of stuff done. So what happens during annual enrollment is people can make changes to their prescription drug plan. That's the Part D, as in drugs. They can also make changes to their Advantage plan during annual enrollment. Okay, that's the only time they can do that. Well, there are other times, but I could spend an hour going into all that. But the majority of it is if you want to change your plan, especially your prescription drug plan during annual enrollment, starts October 15th and runs to December 7th. All right. Choosing the right insurance advisor. So this is not a sales presentation, as I hope that you all see, and I'm not here to sell anybody anything. This is strictly Medicare 101. It can be difficult if you try to do these things on your own. Can you do them on your own? Absolutely, you can. You can go on to Medicare.gov. You can do a lot of these things on your own. But the majority of the phone calls that I get from people that have tried to do it on their own is I'm trying to clean up things. And the reason why is because when you call somebody on the phone, if you call a company on the phone, they're only going to push you for that one plan that they're offering, which may not be the right plan for you. As we talked about earlier, everybody has a different situation. By choosing an insurance advisor, first of all, we don't charge anything for our services, so it doesn't cost anything. You have someone to talk to. that offers the best products and services, providing outstanding customer support for our products and services. You have someone to turn to. If you do everything yourself online or an 800 number, and I see it every week, someone calls me and they're routed another country and they're on the phone for an hour and a half trying to get a simple question answered. We can take care of those for you, or your agent can take care of those for you. Always, be easy to do business with. Make things easy, follow through with commitments, anticipate customer needs, keep up with the ever-changing Medicare markets, and review with you your needs and situation changes. And what that means is annual enrollment is coming up for us. We have a lot of clients that some of them take a lot of high-end expensive drugs. Those are the type of people that we have to get to first, because these prescription drug plans change. So we make sure that the formularies didn't change on the plan they're in, or there's a better plan that they could go in, and we help them make that change. There's no cost to do that, but we're always there. Your agent should be there to help you navigate these tricky waters as far as what plans are good, what's being added, what's being dropped. So lots of things happen, and it's good to have an agent there that can walk you through that stuff. I literally just had one last week. A gentleman called in, did an 800 number, and it turned out to be a nightmare. And I spent an hour and a half on the phone with him and 2 different insurance companies to get him out of what he just did. And we got him turned around and put into the right plan. And he was very thankful that we were able to help him. But sometimes that happens when you just try to do an 800 number. And I'm not saying that's always going to happen, but it can happen. So.
Yeah, Pat, you had shared that story with me prior, and it sounded like the company had called, enrolled him in a certain part of Medicare when he wasn't even enrolled in like the very basic part of Medicare, right? And
that is correct.
Had no answer. They had no answer for that. So I think it is really important to find somebody, whether it's your financial advisor or one of the Medicare specialists, to help you through this, because it is so confusing if you are trying to do it by yourself. And I think a good piece that you had mentioned, which I just want to caution everyone on the webinar today, if you are receiving a lot of those phone calls, before you do anything, try to seek out advice from a third party, because to Pat's point, what can happen is if somebody's calling you and trying to sell you a certain part of that insurance, they might be getting paid for that piece of it. So you just always want to make sure, I think, that it's the best thing for you. We'll take any other questions at this point. So I'll give everybody just a minute to maybe add that into the box before we start to close down for the day. Pat, one question that has come through is, has Medicare enrollment rules changed in response to COVID?
I caught part of that, Michelle. Will Medicare change in response to COVID? Was that the question?
Has Medicare enrollment rules changed in response to COVID?
There has been some different companies are doing some different things. So some of them are waiving copays. Some of them are giving what we call a SEP, which stands for Special Election Period in certain areas and for certain demographics. So yes, there has been some changes for COVID. A lot of the carriers have been waiving copays on certain drugs. If you need to get a COVID test and you're on a Medicare Advantage plan and there was, let's say, a $25 copay for testing, they'll waive that $25 copay. So yes, there have been some changes for COVID.
Great. Well, unless anybody asks another question in the next minute or so, just as far as next steps, a couple things. Make sure that you reach out to your financial advisor or to a Medicare specialist like Pat. Pat's information is here. You always want to make sure that you're reviewing what's going to be the best for your particular situation. And everybody is a little bit different on which plan you're going to choose. Make sure that you are talking about this about 3 months or so prior to going on Medicare, because you don't want to have any issues or penalties that might apply. So at this point, Pat, I don't have any other questions that have come through. I want to thank you so much for your time today. And we will be sending out a couple of those handouts that Pat had mentioned, just so that you all can refer to. And I'd also like to mention, we do have one more part to this series, which is on Social Security, and that's going to be on October 7th. So if you'd like to join us for that, we will have that available to you also at the noon hour. So again, Pat, thank you so much for being here with us today, and for having Ohio Health just give us some nice education.
Well, thank you, Michelle. I appreciate it. I hope I was able to answer everybody's questions. I hope that everyone has a healthy and safe rest of the year. And please don't hesitate to give us a call if you have any questions regarding Medicare. And thank you, Michelle and Annika at Fairport and Luma, for including us today. You guys are wonderful partners, and we appreciate the opportunity.
Thank you.
Thank you. Have a great day, everybody.